Lankford's looking up his notes, running in from the last hearing, trying to be able to get reset. Y'all, thank you. Many of us are running back and forth to multiple hearings today, and interestingly enough, a lot of conversation on the Hill about drugs in general. One of my questions is, let me set a scenario in front of us. Russia invades Ukraine, and so immediately the United States cuts off Russian companies, and American companies based in Russia shut down. China invades Taiwan. The United States says, we're not going to do business with China right now. 10,000 some odd number of our active ingredients are coming out of China. What happens that next day? Yeah, John.
Well, 3 years ago, almost to this day, China threatened to cut us off. I mean, we were complaining about COVID, and they said, if you keep complaining, we'll just cut off your drugs. Now, it's not in their self-interest to do it, but China has a lot of power over our drug market, and we know that they care about things other than maximizing profit.
Yeah. Anyone else want to jump in on the conversation? Go ahead.
Thank you for that question, and I would say that that's one of the reasons why we need more transparency to identify exactly which products we're relying on China for and which ones we might have some diversification in. We also don't have any idea about the key starting materials that China is holding, and so that would be very important to investigate.
Go ahead.
May I?
Go ahead.
Yeah, just to add a little bit to what Aaron Fox said. I particularly want to emphasize that there is anecdotal evidence that we rely on China for the key raw chemicals that go into making our pharmaceuticals. That might be true. We just don't know because we haven't done the systematic analysis.
Okay. Who else did you want to mention something on that as well? Go ahead.
Sure, I appreciate the question. I'll answer with a specific example. So this past year, one plant in Shanghai that produced a contrast material that's used for radiological scans across the board went down. And literally overnight, half of the U.S. supply of radioactive contrast for radiologic scans was unavailable. I work in the VA system. This impacted veterans literally overnight, where we needed to make decisions about whether we were going to allow some scans to be done to evaluate someone's cancer or treat someone's heart disease. Veterans deserve better, and we should not be reliant on a supply chain that's that tenuous.
So where are the next sources? What countries, what agencies, what entities, what drug companies are actually stepping up into this and saying, we're bringing the manufacturing back here, we understand that we're vulnerable at this point, and so we're actually doing something about it?
It's my understanding that the brand companies who also use overseas suppliers mainly use Europe and maybe Puerto Rico, but they don't. I think most of our brand drugs are not produced in China or India. So the China and India production is there because of the race to the bottom and competing on price alone. If all you care about is price, you go to the place in the world where you can get price the lowest, and those are two countries where you can do that.
But that's also where the generic active ingredients are coming out of.
Yes.
Right. What other countries or entities? I know Saudi Arabia and UAE are rapidly accelerating drug manufacturing and trying to be able to do some of the things to set up a process for that. There are other countries that are trying to engage in it, but I don't hear a lot of the race to try to figure out how we do low-cost alternatives in other places. Because those low-cost alternatives and many of the older drugs are the only option and the only place that it's there. So it may be new technology and new innovation for one type, but for older technology and antibiotics and such, it's very different.
You know, Mark Cuban told me the other day that he's building a manufacturing plant right here in the United States, and he sells generic drugs. For him to be successful, I think he has to be able to advertise and convince the buyers that his product is reliable, consistent, safe, efficacious. But you know, he's selling, and this goes back to what Dr. Paul asked me, he's selling directly to the consumer. They don't even accept third-party payment. And maybe that manufacturer-to-consumer model is going to work better than everything else we've been experiencing.
It can't work worse than the PBM model that we currently have.
I agree with that.
Okay, anyone else make comment on that? Other places?
Senator, I do want to talk a little bit about the promise of pharmaceutical continuous manufacturing. These are sort of novel approaches to manufacturing that, hold great promise in terms of bringing our medicine supply onshore. It might make sense particularly for certain critical medicines that we rely on as patients. Pharmaceutical continuous manufacturing can be scaled up rapidly. It has lower production costs. It has a smaller environmental footprint, but we need to make it easier for manufacturers to enter the market. Manufacturers, remember here we're talking about drugs where manufacturers are getting paid pennies per unit. And so we need to make it easier for them by funding things like workforce development. People in this country don't know how to work with these new technologies necessarily. They're new. We need to, build out industry-wide best practices, methodologies. And Congress has actually funded legislation to be able to, has the omnibus spending law actually addresses this point. So I look forward to where that goes, and it's a great first step.
Well, we have found ways to be able to push a lot of the manufacturing out of Puerto Rico that was well known for having a lot of the drug manufacturing, and push it out of the United States and multiple other areas. We currently are one of the worst countries in the world for R&D based on our current tax policy. It literally punishes companies for doing R&D here. We currently are getting out of the manufacturing tax policy, where for manufacturing it was up until this past year that you could actually get a full expensing for that. Now that full expensing has just gone away. And we're actually punishing people for doing manufacturing here. So if we don't fix our tax policy and incentivize manufacturing to actually be here rather than punishing people to do manufacturing here, and if we don't reduce some of the hoops to actually do the manufacturing or allow innovation, like what you've talked about on this, to be able to do directly from the manufacturer in other ways and get around some of the PBMs, we're in trouble. But currently, there's very little incentive to be able to onshore things based on our tax policy and our regulatory environment when we desperately need it. And when I ask people about how quickly can we get drugs out of China to be able to do this and just get access to it, they talk in decades, not in years. That's not a good scenario for us right now with currently a growing hostile threat from the Chinese. So thank you.